look, it didn't do anything to us. And it is true that ever since modernity began, so beginning in the 17th century, when the pace of change really begins to accelerate generation to generation, the next generation actually is a little different from the previous one. And generally, we think the next generation, they're kind of soft. They don't have our virtues. They have funny habits. So that's always been going on. And that's what I'm a late baby boomer. I was born in 1963. So that's what we thought about. The millennial generation. They're always just focused on their coffee and their avocado toast. They're not serious. But actually, and you're a millennial, I believe, right?
Yes, that's correct.
So millennials born 1981 through 1995, roughly. But the millennials, their mental health was actually pretty good, better than Gen X, actually. And they're an amazingly successful generation. They were creative. They traveled the world. They start companies. So that's the normal intergenerational difference. This time is really, really different because all of a sudden, in 2012, 2013, it's like someone flicked on a light switch, and all over the developed world, we don't have data from the developing world, but all over the developed world, certainly the English-speaking countries, Scandinavia, girls in particular began to get depressed, anxious. They began to cut themselves. They began checking into psychiatric wards right around 2013. In the US, it's very sharp, right around 2013. It sometimes is a little bit, but it's basically the early 2010s. This has never happened before. There has never been a global synchronized collapse of mental health. This is far larger than anything we've ever seen in terms of its effects on kids. This is way, way larger than COVID. This is affecting most kids.